Good morning, it's Nurse Maddie here with some more Pnes and Pnea information. So I'm actually just reading over an article in the National Library of Medicine for our through NIH basically. And the very first line in the introduction, this is what I'm trying to spread awareness for. PNES are relatively common but poorly understood and often misdiagnosed as epilepsy, which can lead to unnecessary procedures and treatments along with the possibility of failure to engage patients in necessary behavioral health care. So the very first line, it tells me how it's poorly understood, which I think a lot of us who have it know now. But as far as healthcare providers, this awareness is for you so you can do better treating patients that are diagnosed with this disease. Do not call them pseudo seizures. Do not say the patient is faking it. There may be some that may do that, but for the majority of people, they're not faking. They don't want their body to seize and have aches for a week at a time and have between 5 and 10 seizures a day, which is also another characteristic of PNES versus epilepsy, is the number of episodes people have daily, as well as the time that they last. So usually if you have an epileptic seizure, it's kind of in and out pretty quick, maybe less than 10 minutes, usually responds to medications like lorazepam or other benzodiazepines, as well as anti-epileptic drugs. Well, with PNES and Pnea, none of these medications work. So the person stays in this state of seizing for sometimes up to an hour. Mine, I've had a couple of hour-long episodes, and you wake up afterwards, and when I tell you you worked out every muscle in your body during those seizures, you have worked out every freaking muscle, okay? And you're sore. It hurts. It's not fun. So to assume people are faking it is really harmful and detrimental to the well-being of your patient. So the next thing I was looking at is basically how often it's misdiagnosed as epilepsy or epilepsy that's non-responsive to medications, because it does take some different tests, and it takes a healthcare team to make this diagnosis. Usually neurologists, psychiatrists, along with your internal medicine, but psychologists and your therapists as well should all be a part of your healthcare team. There's always a disconnect between mental and physical ailments. That's another thing we need to change. There should be no disconnect. We should work in tandem. You can't just say, oh, it's not physiological, there's nothing I can do for you, goodbye. Instead, provide resources. I remember my experience at the hospital when the social worker came in and basically was like, well, I don't know what to tell you. I don't have any resources. I don't have any information. She was useless because she couldn't find anything on PNES. I found out more myself. So, okay. So reading through this article, it is a good article. It definitely goes over the phrase pseudo seizure and how that is outdated. Pseudo implies the word fake. Patients do not like to use that term because they are not faking it. Again, not faking it. Okay, the next thing I want to talk about is the prevalence of it, okay? So mostly, of course, it's more profound in women, or mostly women are diagnosed with it. I'm surprised they're not calling it hysterics again like back in the day. But anyways, It's usually women that are diagnosed. Psychiatric comorbidities also play a part. So anyone with depression, anxiety, or PTSD is at risk of developing PNES or Pnea. So that's a lot of people. It's a lot of people. It can happen to anyone. It's as common as MS per the statistics. So we need to just spread awareness. We need to learn. We need to educate ourselves so we can educate others. I want the healthcare professionals, such as myself, educate yourself. Treat your patient better. Listen to them. Have compassion. And know what to do when someone's having a PNES attack versus an epileptic attack. We can do better. Again, Nurse Maddie. I'll post more videos as I get more information. Hopefully this will help. I will add any links to this article below. Like, follow, share. Please spread awareness. Please help those that need our help.